Patterson. We're super excited to have you here today.
Thank you so much. Thank you, Nina, for introducing me. Thank you all for being on the call. I love to see everybody from all the different states throughout the United States. Wish I was out west right now with the warm weather in California. But I'm here based in Connecticut, in Fairfield, Connecticut. And I'm really excited to talk to all of you about medicine, your career. I know all of you are pre-health in terms of pre-health shadowing, pre-medical studies. And I'm really excited to share my experience because I actually have a really varied experience in naturopathic medicine, actually also as a healthcare administrator for over a decade as a senior healthcare executive administrator. So I have kind of varied experience. And so I'm really, really excited today to share my story today. And then also, if at all, I'll check the chat box. You have any questions as I'm presenting, I will be sure to answer those questions. Okay, so let's get started. Let me share my screen. Okay, so who I am. So Nina gave a little bit of information about me. So I am a nationally and now internationally recognized naturopathic doctor. I'm also the immediate past president of the American Association for Naturopathic Physicians. So it's the national organization for licensed, naturopathic doctors. And so I'm currently the immediate past president, and actually was the first president of color in the tenure, actually as the AANMC president and the youngest actually president at the time. So I am finishing out this year and, my camera get down. Okay, finishing out this year. And so that was a great experience. I was on the board for a period of time. So I am also a success coach. So one of the things based on my experience, have been really good at running a private practice. So in my business, I actually have a brick and mortar. I also do telemedicine, which is about 40% of our practice, 30% to 40% of our practice. And it has been that way actually pre-COVID. Now we actually have a lot more that are telemedicine. But prior to COVID, based on our area of niche, we have a lot of people outside of the state that come to get services from us. And then also I'm an author. So I'm a best-selling author, Amazon author. And the reason I coach doctors is because we have a really successful practice. I was successful 3 months out of opening a practice. And based on that, people just asked me to coach them. And so before I knew it, in the last couple of years, I've been coaching other doctors in integrative medicine, naturopathic doctors, functional medicine doctors, including MDs, that are interested in more of like a holistic approach to care. And so my areas particularly of specialty are Lyme disease and infections. Lyme disease was founded in Connecticut, in Lyme, Connecticut. So obviously I have a lot more patients than probably normal with Lyme disease. Also, I focus on autoimmune conditions, and then also anxiety and depression. That's a huge thing I see. Your generation, I'm much older than all of you, so your generation actually is one of the highest rates of mental health disorders, anxiety and depression, out of any generation before and after, actually. So unprecedented. COVID hasn't helped with that, but the age of young adults is very common for me to see, particularly with anxiety and depression. So it's an area of focus for us. Lyme disease is a big niche. There's not that many people that specialize in it. And that's one of the reasons why we see people actually throughout the country and also internationally for their care in our office. My practice is also interesting because it's a multidisciplinary practice. So we have, internal medicine, we have nutrition, we also have obviously naturopathic doctors, we have acupuncture. And so we collaborate a lot with like local providers in different specialty areas as well, because one of the big pieces in terms of our philosophy in our office is healthcare as it should be. So it's really important to us that like the care is really like people are seen as like whole people, and that the care is really interconnected. And so that's something that we really pride ourselves on. It's one of the things that when people walk into our office is the first thing they say is like, oh, this feels different, or I feel really comfortable here. They feel like they feel very nurtured, they feel supported, they feel at home. That's like the most common thing people say when they walk in, that this place feels different or their experience in the office is different. And so we want to change to be really connected to the community, but also seeing people fully as they are through all of their experiences, their life experiences, trauma, what happened before they were ill, also just like, everything in terms of them being empowered. That's one of the things they often say is they feel that when they're educated on their lab work, we spend a lot more time with patients in terms of their care, about 60 minutes to 90 minutes for their initial office visit, which is a lot different than conventional medicine, which might be 15 or 20 minutes. Unfortunately, it's only that way because of the healthcare model. And so the great thing is, since we get to spend a lot more time with patients, we can often get to things that might take months if weren't able to have the opportunity to have those conversations. So we get to the root cause of disease. It's part of our tenets. As naturopathic doctors, we have 6 core tenets. So it's a few of which are prevention, treat the whole person, get to the underlying cause of disease. And so those are all pieces that we focus on when we're treating people. And oftentimes we do treat in collaboration with medication. We are trained in drug herb interaction. And so that's a thing we have to deal with a lot in our office. And it's a great collaboration between all. So one of those that's part of our philosophy, and one of the things that we really focus on a lot in our office, of that level of collaboration and making sure they really we get to meet them where they're at and make sure all of their needs are met. So I'll share a little bit about my college experience. This is me much younger. So this is in Cornell University. I actually went undergrad, 98, graduated in 02. I originally went in as a plant science major. So my full story is I was interested in actually integrative medicine since I went into school. My mother, when I was 15, well, I was always introduced. My dad used to take me to all the health food stores. I'm of mixed race, so I'm half Black, half Chinese. And so I got to see, growing up a little bit, my grandmother doing, Chinese medicine and those types of things. So I always had an interest. And then when I was around 15 years old, my mother got really sick. They really couldn't figure out what she had. And she was pretty much like on death's door. Like she dropped down to like 90 pounds or 85 pounds. My dad had to lift her up and down the stairs because she was really, really sick, and they literally couldn't figure out what was wrong. So after time, they finally figured it out, and she ended up getting diagnosed with lupus. So she had lupus and rheumatoid arthritis. And so part of my struggle, I think at the time, I got actually really disillusioned with medicine because I felt like there was no conversation and collaboration. And so, pieces were looked at as her, different pieces of her instead of like everything that was going on. And so for me, knew that whatever type of medicine I did, I wanted to make sure in whatever model of care I provided, that everything was like, we looked at every piece and everybody collaborated. And it's probably essentially why the model of care we provide now at our office is the way it is. And so I was actually in a traditional medical track when I went into school. Was interested in plant sciences. When I was in school, I was actually in a program through New Jersey Medical School, and I would have actually been able to go to New Jersey Medical School without the MCAT and automatic enrollment. But I knew for me, and I had a lot of family members that were, allopathic MDs, just traditional, conventional MDs. And for me, I didn't have any issue against it. It just didn't feel right. Like I wasn't able to see myself in a hospital. I wasn't able to envision myself in like the current model of care. I know now people know about functional medicine, but back then the only person that was spoken about was Andrew Weil. So I didn't know that there were these other options. And so I ended up changing my degree because I didn't know what path to go. I knew that I couldn't see myself in any other way of medicine. I think the only thing I might have liked was like neurology, in terms of being like a neurologist or a brain surgeon or something crazy like that. That was probably the only other thing I was interested in. But I knew for me, I felt like it didn't fit. It didn't resonate in my heart. And so what I did was I actually changed my degree because I went to a safe major just to like figure out what I wanted to do with my life. and I changed it to economics and business. And then in the last couple of years while I was in school, I learned about naturopathic medicine, or I think the last year. And so when I learned about it, I actually was like, wow, this is the perfect fit for me. This is exactly what I wanted to do. I just didn't know what it was called. And so what I did was I went back, took all the pre-medical requirements, and I ended up working for a couple years in like marketing and business analytics, and then ultimately went back to school. And all of that, and I'll share more about my story as we go on, all built upon each other. At the time, you realize like no time is actually wasted. Every single experience you have always amounts to helping you in something in your life later. And so, like I said, my business was really successful. And a lot of the reason why was I had this kind of business acumen and experience that ended up helping me to be successful when it came to practice, and also eventually some of the future work that I did. So I had that degree, but took the pre-medical requirements, went back into school, and then I enrolled at the University of Bridgeport. So 2 years later, I enrolled at University of Bridgeport College of Naturopathic Medicine from 2004 to 2008. During our program, it's a 4-year doctoral program, and we take 2 licensing examinations, a total of 1,400 clinical hours. So we take all of the same core basic sciences for the first couple years. But in the last few years, we start focusing more on the integrated modalities. So part of what we always say as naturopathic doctors is that we have a lot of tools in our toolbox. And if you have just a hammer and a nail, you would just, everything would look like a nail. But with us, we have a lot of tools. So we can pull in different tools of our toolbox. And so that includes acupuncture, that includes, nutritional supplementation, that includes dietary and lifestyle modifications, herbal medicine, that includes even manipulation. We learn naturopathic manipulation. We also learn lifestyle and counseling as well, massage, like everything. And so what's great about that is we also have like pharmacology classes that we're also required to have, and we learn the interaction. So we know if a patient is, let's say, on a psychotropic medication, like let's say a benzodiazepine, like lorazepam, or on Xanax, or a serotonin, anything like a Prozac, we understand clearly like how the drug and the herbs interact with that, and how to work with somebody on that. And the reason that's important is, regardless of whatever field of medicine and profession you go to, it's really important that care is collaborate, that there's a collaboration, because people can often be on things that can actually decrease its effectiveness, or can actually affect people negatively. I've had patients with really high liver enzymes because of supplements they were on, to the point that it actually looked like they had hepatitis. I've had people that have had kidney issues because of supplements that they've had at high dose, and nobody actually reviewed it with them. And so it's really important that anybody in the medical field is working with somebody that has education in that, because you have to be really careful. And so what happens is, with a lot of the patients I see, they may or may not tell their conventional, their traditional medical doctor, because they're worried that they'll just be told not to take it. And they're taking it in secret and they don't say it, but they say it to us because that's our jam. That's what we do. And so lots of times I'm going through, like, especially someone that's, let's say, older, that might be on 20 supplements, I have to reconcile and often take them off of things, and or consolidate that. So it's really important to work in collaboration, because you want to make sure ultimately that we're doing what's the best for the patient in terms of safety. And so we do the clinical hours, we have precepting hours, we have to pass 2 license exams to be licensed as naturopathic doctors. Also, we have available in terms of residencies, and currently in the United States, there's 22 licensed states. It's one of the things I was really active in on the national board, is trying to get a lot more states licensed. And the reason that's important is because the more states that are licensed, you have, doctors out there that have the proper education and training, again, for the safety of the patients. And a lot of people don't know that. They might be in a state, let's say New Jersey, which is, I'm from New Jersey originally. I'm completely a Jersey girl, but I'm in Connecticut. It's not a licensed state. So you can have people calling themselves a naturopathic doctor that just, didn't necessarily have all of that credentialed training. And so being in a licensed state, which the 22 licensed states, Connecticut is one, it really requires that you have a certain level of training, education, exams that are passed to be able to practice medicine in the state. So it's really important, and is one of the reasons why we've really pushed in my involvement while I was the immediate past president, was working on getting states licensed. And we had 5 states licensed under my purview, which is actually unprecedented to have that many in 2 years. So that's been a big push, and we'll continue moving forward to help make sure we're available to more people, and also for the safety of just people at large. So the one thing I want to say about this here too is, while I was at University of Bridgeport, I found I had a real interest in public health, working with communities. I had an interest in basically just community medicine. And so during the time I was in school, I did a lot of volunteer work. I worked with NAACP. I worked with the public health department in the city. I put on events at that time, the 50 million pound challenge, which you all probably don't know about because it was a while ago, with Dr. Ian Smith, who was actually had a reality TV show again. It was part of the celebrity 50 million pound challenge. And so we did collaborations with him and the program in the city of Bridgeport to have people lose weight in the city and help with chronic disease conditions. And so during the course of the time, I found I really liked it, and I spent a lot of time there. And I was at a lobbying event in New York, and this speaks to, you never know who you're going to meet and network with. And actually, every job I've had outside of college has always been a job that's been created. Every opportunity has been something that's been created in my life. And so that's all been by the power of relationships. And so I was at a lobby day. The person had stopped by 20 tables, and the CEO stopped, and she's like, "I love your pitch. I'm going to hire you. I have no idea what I'm going to hire you for, but I'm going to create a job." And so she created a position for me, and I stayed in touch with her for a year. And when I graduated, I actually worked in the Bronx for several years at a community health center, where I worked on childhood obesity. Childhood obesity was actually the largest at that time, or I think the Bronx was the highest at that time in the United States of childhood obesity. And I worked with a pediatric endocrinologist to lower the numbers. And we actually did a really great job. And that model ended up getting selected to be used throughout other community health centers in New York City. And we also presented nationally on that with the American Public Health Association on our work with childhood obesity. Also, I was responsible for working with the poorly controlled diabetics. So those were ones that had A1Cs, which is a thing that measures your blood sugar over 3 months. And so we work with them, and we had a lot of them improve. One of the really interesting things was, I'll never forget the story where we had one person in the group, patient we're working with in the group, that was homeless, and she didn't have insurance, and she actually went to the emergency room about once a week. And once a week. So imagine how much thousands of dollars that was, because she wasn't connected with healthcare and she didn't know what to do. And when she did our program for 3 months, in that whole time, she actually didn't go to the emergency room one time. And her numbers got significantly better. So it was really cool to see. She didn't even tell us that until she graduated. She's like, "Oh, I haven't been to the emergency room once in the whole time." And she had used to be in every single week. And so what we saw with that was a lot of the pieces that were important with health education, connection with the provider, group work. So a lot of the sessions we did was were as groups, and people really had that sense of community to help encourage them to stick to plan, and they had a lot of support in order to get better. And so I did that for a few years. And what happened was, as I started doing that, I got really, really good at starting programs, leading programs, operations, systems. And so over time, I developed to being working in community health centers, where I headed quality improvement. I then went on to oversee operations. And then in my last place, before I kind of left it all and went back fully into practicing full time, I worked in community and behavioral health for integrated care, leading integrated care initiatives throughout these locations. We had 32 locations. We had 32 locations and 86 programs. And so I led the work of creating these integrated care models and systems throughout this place. And so I headed operations, I headed quality improvement, I headed compliance, I had a team of over 80 staff. And so I did that before I decided to quit it all and actually go into fully running a practice over the last 3 years. So I was practicing part-time, and then I did this operation, this job. And what I found was I was a really, really good healthcare executive, but I felt like I was living like 85% in my purpose. So it goes back to like what I kind of said before with like, medicine. And so I felt like my job was good. I got 6 weeks of vacation. I had a pension. I actually would have had 5 years away from getting all of my student loans paid off. I had a high salary. I was able to work from home 1 or 2 days a week. And I kept feeling like I was missing something. And so I decided to quit it all and become a complete entrepreneur and business owner. And haven't looked back from that. So I literally stopped all of that, and which was really risky. And I felt like I didn't want to look back, like even if it was 1 year or 1 month, and say like I had a regret. And I just was like, I can't look back, even if it's like literally a year or 2 years, and say that I didn't get to do everything I really, really wanted to do in my life. And there were a lot of people around me that had issues. I had actually some people not far away in age to me that had passed away. And I just was like, wow, you don't have that much time sometimes to make an influence. And I didn't want to have any regret. I didn't want to look back 10 years from now and feel like I was wasting my time. So I gave all of that up. I, again, practicing part-time, working as a high top healthcare administrator. And I took over medical practice. And in 6 weeks, the practice had grown from what it was before in the previous practice owner. So I took the leap of faith and never looked back. And since then, it's been really exciting because I've been able to create my own model of care. I created my own model of care. I became, like I said, a business coach. I received recently Medical Moguls Award of the Year. I also was selected as a Forbes business council. I'm a Forbes contributor. So ever since then, everything has looked up. I'm a national speaker, presenter, where I often speak to audiences over 500 in the functional medicine space. So my career has went through so many different changes, and my life has been in so many changes. The reason I'm saying that is because I remember being in your shoes and feeling oftentimes lost, or sometimes people telling me not to do the things I was doing. When I went to go into a non-traditional medical track, I was told it was quackery. I was told, why am I doing these things instead of something that was very safe? And I said, I just had to follow my heart. And so I've done that multiple times. I'm wondering what the next thing is going to be for me, because it feels like, I guess it's on the every 10-year mark. I completely change it up. And so right now I'm, running a successful integrative medical practice, and we're actually just opening up another annex site, which is going to be a wellness site. And I really want to show it as a test model of how to offer care in a way where we have cooking demonstrations with kitchen. We have trainers there. We have PT. We have wellness retreats. It's going to be a completely changing that whole thing, expanding our current center from what it is, and offering all those pieces, including things like careers, helping people have social connections, because that's also really, really connected to wellness, is people having, 3 to 5 contacts. And I think COVID has really shown it better than anything, the importance of connection. Even if you're introverted, I consider myself an introvert, the importance of connection and how much that affects your mental health. It actually even affects how long you live. People that have less than 5 connections live 5 to 7 years less than people that do. And so one of the other important pieces to me is how to develop that community connection. That's not just only healthcare, seeing the doctor, as this kind of like godlike thing, but actually seeing all the pieces and helping them, support them in all ways, by way of, lifestyle, by way of obviously medical care, by way of exercise, by way of nutrition, by way of community, connection, all of those things, and career are all really, really important. So let me just make sure there's no questions really quickly. Okay, I just want to make sure. Okay, so I'm going to go through some clinical cases. So 2 cases that I wanted to share. Okay, so I'm going to actually just do a couple. So this is because this is the common kind of patient I see that's in, and I wanted to make something relevant to your age and generation. And so this is a 19-year-old college student. She struggled with anxiety since she was a child. Her anxiety is specific to academics, though. So very extroverted, very socially engaged, went to school up in Boston. But when it came to anything academic, she would like blank out during the exams, hyperventilate, sweat. She's really hot. She wasn't balanced at all in school. Everything was completely about academics. And she was like that since she was a little kid, to the point that her parents actually wanted her to get tried to get her to get a bad grade so she could be, less preoccupied, which when does that happen? In terms of a parent saying like, it's okay for you to get a B. So because there was so much anxiety around it. Started looking at medication. She was on medication for a little bit, didn't make a change for her. And she was really anxious then also about taking medication or even supplements when I first saw her. So she was scared of driving. She couldn't drive. She couldn't do like any major, like flying, like things that were those major fears that people have, because of just anxiety as well. So the great thing was she had a really solid support network of family and friends. She'd have anxiety before and after exams that caused a lot of gastrointestinal distress, like where she have loose stools, like frequent bowel movements, frequent urination, which made it hard for her to take the exam. So it was before and after. She was also really hypersensitive to her environment, where she said she could study so much in preparation for exams, but she felt like she had to study like 5 times harder than her friends. But then she couldn't think clearly during the exam due to anxiety. Like her mind would go blank. And so she was really hypersensitive to sounds, everything in the environment, and actually during the exam. She slept, even though she was really anxious and she got good sleep, she was always waking really, really tired, because she was just under adrenal distress of just constantly, stressed out. And so energy was poor throughout the day. She had many fears, like I said, driving, scared of the dark, humidity, aggravated her, temperature aggravated her. And anxiety control and good academics was part of who she is. So I did talk to her and her mom when she was in the visit and said, when we get better, one of the pieces that we're going to have to work through, though, is how people see you, because everyone in her family, she came, pigeonholed of like, this is who she is, an anxious person and a person that only cares about her academics. And so part of it is she's going to have to let go of that image and that belief and creation of what people have seen her as part of this, and then also her role in the family, because now with her feeling better and getting well, her family is now going to have to adjust to her being a different person. And so I talked to her about that early on, is like, how will they accept that? Are you ready for that? Please expect this change. And the reason I said that was because I know it happens enough for the people I work with. I've had, kids I've worked with that have felt repressed about feelings. They get on a treatment and they just start saying everything that bothers them, or they, completely all the repressed feelings come up, or their parents or family want to see them still in a certain box. And so when you get well, you change out of that, and the people around you, sometimes even your friends, may be with you or not be with you, and family might not understand that change. So I talked about that really clearly in the beginning, as that often happens. And that's actually exactly what happened in her situation. As she got better, she lost friends. I think actually in the first month, she broke up with her boyfriend. Actually, that commonly happens with my people. They like break up in a relationship, or they get in a relationship, either or. Because lots of times when you're not feeling well, you're so anxious, you kind of just don't deal with situations fully. And so when you feel better, you're kind of like, wait a second, I don't need to deal with this. And that changes that whole dynamic. And so she was a person that happened, friendships that weren't supportive left. And her family, when she got better, were actually worried. Like they thought she was being unsafe because she was now driving, or she wasn't studying as, the same way, or she had less anxiety. And so it was really interesting to talk through that. And we were really happy we had that conversation early on because it was in alignment with what we thought. And so what we did was, this is just an example testing. We checked her cortisol. So cortisol is what wakes you up in the morning, really early in the morning. You have a peak. It's inverse to melatonin. And you wake up like 6 to 8 o'clock. Once the light comes in is when your cortisol goes up. That's why you see babies and kids, they wake up naturally at 5 or 6, even though the parents don't like that, because that's how you're naturally supposed to be. Your cortisol gets to wake you up, or animals are like that, where they get up early. And then at nighttime, your cortisol should be low and the melatonin goes up. And you often have that in the morning. And then you also have that peak in the early afternoon of cortisol. And so if you look at her numbers, she was very low throughout the whole day. Actually, she should be at least 16 to 39, optimal is like in 25. And she was low basically in the morning, and the night, only 2, pretty much negligible in the morning, which made sense because of her fatigue. So we put her on a protocol, things that help to increase up her cortisol for energy. We also put her on things in the middle of the day to help boost that up. And then also just overall looking at things like her DHEA, her, which was also low, which is usually low related to hormones, or also if your cortisol is being used up a lot. So we put her on a particular support regimen of like adaptogens, what they call, to help support her stress. Also, like I said, increase things for cortisol, and some other pieces to just overall balance out her adrenal glands. And so when I saw her, how many months later? 2 months later, we retested her. You see her number increased by 6 points. So she went from 2 to 8. And then her number actually was now in the normal level. So she went from 11, which she was before, out to 18, which is a normal number. And also her DHEA, which I said was lower because of her issue with cortisol, also was a little bit better. So these also adjusted as well. And the biggest thing was when I saw her the next time, the pieces that she had said she felt the biggest difference was that she felt incredible. Her stress was more manageable, even during the exam time. She was able to be balanced. Like during the exam, she was able to be focused. She could think. She was able to take her test. She felt incredible energy-wise. Her energy was better in the morning. She wasn't waking tired. So she said she felt really tired in the morning. That's a thing that my patients often say, like, I wake up, I feel like I got hit by a bus. So that was no longer her situation. Her friends and family also noticed the difference in her anxiety that they were really surprised by. Also, one of the other interesting things was she never said this to me on our first visit, but she told me, even though she was like this effervescent ball of energy, happy, smiley, like I said, extroverted, she was sad. And she never said that to me actually on the first visit. And she said she's no longer sad. She was able to now work through her emotions, and she was less hypersensitive to other feelings. Like she was kind of the person that was a listener with her friends, hypersensitive to people's opinions about her, and she felt a lot less sensitive. So it was really interesting, because that was a thing that she hadn't brought up to me at all, about feeling a little sad or depressed, until like after she was well, and that she, said that she was no longer sad. She also said, which was really nice, she said it was interesting because this was always who she was. However, she felt like she was more her. And also she got to the point where she was doing a lot more self-searching, which she wasn't doing before because she was so stressed. The other thing I mentioned about her being really sensitive to humidity and hot, she also had less heat intolerance. So she wasn't getting these kind of hot flashes, like night sweat kind of thing, which was related to anxiety. That was all balanced, and that wasn't an issue. Also, I mentioned before her exams and before stress, she would have a lot of diarrhea. She was no longer having that. She had no nauseousness, which she had felt nauseous all day. She didn't have diarrhea or bowel movement. So this was all in the period of 5 to 6 weeks, all through natural medicine, all through herbal supplementation and nutritional supplementation, no medication. Okay, and then this other case is the last case that I thought was really cool. The reason I want to share this is actually one of my first cases out of coming out of naturopathic school. And so it was a 3-year-old I had with myasthenia gravis. So myasthenia gravis is an autoimmune condition. And what happens is you have muscle weakness, and there's something called ptosis, which is PTOSIS, which is like eyelid drooping. And so there's like a lack of motor coordination with your body mostly. So sometimes it can affect walking and things like that. But usually a common thing is affecting your eyes, or you're having a drooping eye. So I had a little girl that came in, myasthenia gravis, treated at Princeton. She had like one drooping eye, left eye with no motion. And I wish I could have shown actually the before and after. I didn't have consent, so I couldn't show it, but she had one eye like totally drooped down. She went to Princeton for care. She was put on medication, also prednisone. She was on steroids. So that was concerning because for a little kid, it can actually stunt growth. And so she started falling behind. And the interesting thing, she was also a twin. So she started falling behind the growth curve from her brother. And she also was sleeping a lot during the day, like a lot more than he did. And so they were considering surgery. What they do at that age, if it's early enough, is they remove what's called the thymus gland. And the thymus gland helps with like differentiation for your immune function. And so they were considering that. And the mother really didn't want to do surgery. She wanted to do a natural approach. And so I worked with her. We put her in a series of like immunomodulators. Homeopathy was another thing I did. And then like actually 4 weeks of treatment, her ocular change, like her complete. So when she came, her whole eyelid was completely down like this. And in I think 2 to 4 weeks, her complete eyelid was open. They couldn't even tell, like her external friends couldn't tell the difference of which eye had an issue because one also tracks slower than the other. And actually even Princeton was like, what was this, at the place. They were really interested. Interesting thing enough, one of the guys in her team was married to a naturopathic doctor. So he obviously was very interested, but we prevented her from having surgery. And also she got off of steroids, which was huge obviously because of the fact that, that would have long-term stunted her growth. And no surgery was needed. She continued to be well. I still see her once in a while. She occasionally gets kind of flares in the springtime, which interestingly enough is always the time related to allergies. And that's because her immune system is affected. And so we just do something to support her immune system at that time. She flares a little bit and then goes back to normal. So she's maintained it. She's 7 years old now. So it's been 4 years since that time of when I first started seeing her. And so that was a really, really cool case I had, like very, very early on in treatment, it was very few supplements that were actually used, maybe a handful for her to actually change her symptoms. So I have way more clinical cases I'd love to share if you guys have questions about them in terms of other things I've treated. Just to quote here, the hardest thing for people to see is themselves. And so the reason I said that was that oftentimes we're keeping in terms of our own mindset, we have a path that we kind of envision, but we stop it sometimes because of what we hear, see, or think. And so I just wanted to share my whole story because it changed, like I said, multiple times. And it's really important and that's one of the things I really focus on when I see patients. I'm part of their journey. So like that 19-year-old I talked about, it was so nice to see them and help them in their trajectory in their life. But it's oftentimes the hardest thing for people to see is themselves when they're not well. And so we really work to support them to be able to see themselves. And lots of times, if you're not well, you can't see yourselves. And the same applies, to our own journey in life, and being able to see for ourselves and follow the path that we feel like is in our heart. So I think that's it. Yeah. So this is just my information, medical director, Fairfield Family Health. This is our website and phone number. So again, practicing in Fairfield, Connecticut, and with a multidisciplinary practice. So open to question Q&A right now.
Okay, so we have a couple questions. Our first question will be, did you ever have any difficulty with patients who didn't share all the details of symptoms? And this is a two-part question. How did you navigate that?
So yeah, so that patient, for example, that I just mentioned about feeling depressed and sad, that does happen often, and it actually happens a lot in most excuse me excuse me in medicine in general, because especially if you only have 15 or 20 minutes when you see somebody, you're only seeing pieces of them, right? People put like their best face forward initially, in terms of like and they're also, you have to realize, there's that doctor patient relationship where people might feel fearful to be able to say everything. And so what I try to do is, one of the ways I get them to share all the details, honestly, is by having a longer visit time and asking them those questions. So like, let's say someone says, I'm tired or fatigued and nobody can figure out what's wrong with me. I ask them, like, when did this start? How long has this happened? When did anything predate that? So that's a question a lot of people don't ask. Like, okay, you had autoimmune condition. Did you have a trauma 3 to 5 years before? I find a lot of my patients have had some life situation within, a few years of, or even up to 5 years within their diagnosis. And so lots of times that opens up a can of worms. Like, I'll ask them, they'll be like, oh my gosh, I had a divorce, or I lost this family member, or this thing that was bothering me from a time ago or I had a kid, I've been so stressed, I had postpartum depression. And so a lot of times what I'll see is there's something that kind of predated it. And that's one way I can get, I can kind of get more information. Oops, I'm trying to make sure I'm with sharing the information. So what I do is I tell them really openly, like, I'm here as part of your journey. And over time, more things might come up. And oftentimes it does happen. Like, I fix one thing and they're like, oh, by the way, I've had gastrointestinal issues the whole time too, but I wasn't focused on that. I was only focused on my anxiety because I wanted that to get better. And so you just know that that's part of the process, and you just try to ask as many questions as possible, digging back into like what happened before their history, their social history, which a lot of times we forget to ask, I think, in medicine. And so that's the biggest piece.
What has been the most fulfilling case you've had?
The most fulfilling, actually, I had one girl it's always the college kids. So I had a person, and she lets me share the story. So she was in the Bronx, a college student, and she came, because we're cash based, she actually came 5 hours traveled through public transportation to see me from the Bronx. I was all the way up by Hartford, almost by Massachusetts. And she came to see me, and she took, subway. Then they took Metro North, and then they took an Uber. It was like 3 ways of traveling. And I was like, why did you come this far? I mean, I was nice, but I was like, I don't want you to come this far. I was actually going to connect her to a different doctor. I'm like, let me find you somebody else. Blah, blah. Like, I feel really bad to come this far. How did you find out about? And she's like, no, we're going to come to you because like you helped my cousin, who she didn't even remember, like a distant cousin, with actually Myasthenia Gravis, which is interesting. And she was an older person though, but you helped her, and I saved up my money because she was Medicaid. I saved up my money and I want to see you. And I was like, oh boy, this is like a lot of pressure. Because I'm like, someone came like 4 or 5 hours. She's like, I saved up my money. And it was actually something I hadn't seen before. It was alopecia. So she had no hair. So she came to me, had taken her hair off, was really insecure about it, had a wig on. And I'm like, oh my gosh, like this is an autoimmune condition, but crap, like I haven't seen that. I was like, shit, I haven't seen that many cases with that. So I was honest with her. I told her, I was like, I've dealt with autoimmune a lot. It's my focus, but I don't have that many cases. So I'm going to treat you just like I would with an autoimmune patient, but I can't really promise. I'll let you know. And that's what I tell patients sometimes, if it's something new, or like, I'm going to work my like butt off to make sure you're well. Like if it's something I don't know, I will work my hardest to do the best I can for you. And most people like get that. So I told her that, and she's like, that's okay. And so during the visit, she like took her hair off. She was crying because she was so humiliated to show, that she had no hair. She was 19. She was just like really depressed because of her look. She had issues with her friends because she couldn't tell. She was really quiet and shy. She was like loved writing, like completely, like very, very introverted. And she felt like she had the secret she couldn't tell her friends about because she had like, weaves, or I think had weaves before, but also had a wig, and she felt like her friends didn't know about it. She was African American. So a lot of, in terms of, it was like accustomed to wear like weaves or wigs and things like that. So she had the secrets she felt like she couldn't talk to anybody about. So she was losing a little bit at a time, and then she just lost it like all. And so she was crying about it. So she had like little pieces that she left. And so I saw her, I did like homeopathy, which always opens up again a whole bunch of stuff. I did all these immune modulators, and she came back like 3 months later and had like 3 inches of hair, like everywhere, her whole head. It was like, and I was like, I was even like, what the, like, I was actually surprised. I was like, okay, we can get a little bit. And then she didn't talk to me too. And I was like, what the heck? Like, it was like a full head of hair, like completely full head of hair. And it was like, I think 2 months, because I tried to put the visit out because I was worried about it. And so she, but the coolest thing about her was she was so confident. She changed her major. She spoke up to her friends. She actually told them what was happening with her. It was like all those things that were oppressed, she came out about. And I told her, I was like, that was actually what I was the happiest about, was that she, like, you could just see her blossom. So that was the part that's exciting. Wasn't the only the clinical case, but to see someone like blossom in life and like happy and participating in stuff, changing her major, like that was like amazing. And then I think I saw her like a couple more times, because then I got worried that she got scared then to change her regimen, that she was going to lose hair. And so all of a sudden, I think I saw her like 2 years ago. I hadn't heard from her. She like didn't come for an appointment, what have you. And then I got worried because she wasn't like that. And I reached out to her multiple times, didn't hear from her. And then she literally wrote to me. That always happens to me. I'll be like, I wonder what happened to that person. And she literally wrote me like 3 months ago and was like, hey, Dr. Patterson, I just wanted you to know, I'm so sorry. I didn't respond to you. A lot of stuff in my life has changed, but I wanted you to know. And she sent a picture of herself with like this big afro, go full head afro. It's like, I wanted to let you know that my health is still well. Thank you so much for being there for like this really critical part of my life. She's actually thinking of going into medicine. Yep. Changing her degree, another changing of her degree. And I was just like, wow. So that like made my day. So that's like a case I won't forget, because it was one of those people that took a risk by like taking that travel, and like that I was like, actually I didn't know what was going to happen. And seeing that, but the biggest piece was like her life, to see her whole life change as a result. So
That is so amazing. That. So now our next question is going to be, what was your most difficult case you've worked?
I think the most difficult, I think I'd say the most difficult cases I've had are the people, I want to say it more general. Sometimes have been patients that I'd say won't let go of their own, I guess. Sometimes mental health. Like I've had patients that have like significant bipolar, schizophrenia, and they don't want to be on medication, and it's not safe. It's not safe at that point. I definitely believe in the balance of both, and that at some point you need an intervention. And I've had it where some patients like refuse, and I've had to really push them against that. And patient, in terms of like not wanting to be on medication, I don't think it's safe. Or I've had a patient one time that was older, and I was really concerned by his numbers, and he refused to get medication. I said, your numbers are through the roof. It was like E. coli, like all these infections. I was like, they were older, like 75. I'm like, his PSA was like 15. That's supposed to be below 4. And he refused. Like, I don't want to get antibiotics. I don't want to get any treatment. What's wrong with you? You're a natural doctor. You shouldn't believe in that. You should be against this. And I'm like, at the end of the day, like, I'm for the safety of the patient. Like at this point, you have to do something stronger, or you're going to end up getting like sepsis, like be hospitalized. He refused. And so we had, write a letter, let them know like this is going against medical care, and that happens in medicine all the time, and what I really wanted them to do. And the person, we didn't know what happened. So then I think it was a few months later, we ran into them, and he actually ended up getting hospitalized. Exactly what I thought was going to happen. He got hospitalized. He almost lost his prostate. It was like a little bit away from like having full sepsis where he would have died. And so sometimes you have to make those decisions of like when there's a higher level of like, okay, even though you want to go down this route, or patients sometimes also the opposite, that they want to be sick and they won't let go of that, like, okay, you have this, but like you're getting better, but think they have like a death sentence for forever, for things that are just mild conditions. And so that's also hard. It's like the mindset with people of like not wanting to get the care that you want sometimes, or also wanting to be like really stuck on that illness or disease condition they have. So.
Thank you. Can you elaborate on the cortisol support regimen that you prescribed for the first case study? You mentioned that it wasn't considered medication per se, but herbal supplements.
Yeah, so a couple of supplements we did. So we did Cortex fractions, which is from actually from animal source called bovine source. So Cortex fractions. There's also something called licorice root, which you may have heard of. You do have to be careful with licorice root though, because it does increase up your blood pressure, like 10 to 20 points. But it does is it increases the half-life of cortisol. So it doubles the cortisol, your body's production of it. So those are two. And then we put her on things to drop down cortisol, or no, sometimes I do things to drop cortisol down for somebody that's really high. So one of them is something called phosphatidylserine, which has been studied and used for that. Phosphatidylserine has also been studied and used for Alzheimer's. So it's something that they use, it helps the phospholipids of the brain. So it helps with the connection in the brain's neurotransmitters, and also has been helpful for use and studied for like ADHD, for focus. But it also in a higher amount has been shown to drop cortisol levels down. So somebody that has like really high cortisol, I might consider something like that, or herbs like magnolia and things that have also been studied to help with stress.
Thank you. So our next question would be, have you ever lost a patient and how do you deal with that?
I have several patients. One most recently it was really sad because I knew the family. I had worked with the son on a project, and he had been saying he wanted his dad to come and see me for like a year. Kept saying he wanted him to see me for a year. Then when he came, it was like this immediate urgent situation. And he came in, he was like jaundice. I looked at his numbers, his enzymes, pancreatics, and I knew that was like completely pancreatic cancer. And so it was hard because I'm in the consult the whole time knowing, wow, like this is pretty significant. And he was still getting worked up at Yale to get fully diagnosed. He did get diagnosed with pancreatic cancer. He had like stage 4, and he died in a week. So I had seen him, and like 7 days later, he passed away. So it was really hard because I knew the family, but he was just this like the nicest guy, and they were just really hopeful that it would be a case. But it was a big feeling because it was like for the whole family to see the father just change overnight. Like he just had a little bit of back pain, and then into like 2 weeks, dying, was just really, really hard because he was like 60 something. He wasn't that old. So that was hard, like how to deal with it. We debriefed with the team. Unfortunately, yes, it was really hard. Went to the funeral, those kind of things, but to be able to see that and happen so fast is hard. Unfortunately, when I was an administrator, I also had to be the one because I worked in addiction and also mental health. So I often was the person weekly submitting deaths for suicide. Suicide has always been the hardest probably for me, to be honest. Addiction to suicide is always the hardest for me because I always think like, somebody could have said this one thing, or, could this have done this one little thing different that could have prevented that from happening. So I often had to submit reports for suicide too. And so I used to often do debriefs with my team on like how they felt about it. Also, how do we protect ourselves from it? How do we not read as many of the details about the cases so that we can help to protect ourselves as well? So I do like meditation, or spirituality, whatever it is for you, like daily. And so those are the things, the way to ground myself, but also meeting with the team to make sure they also feel okay.
As an introvert, how did you get past the hesitancy and anxiety of talking to people and have networking and presentation skills?
So, and I also saw someone put something about imposter syndrome. So I'll couple that together, as I feel like it kind of all comes together. I definitely had imposter syndrome for a while. And I think too, as a woman, also women of color, that it's like you even have more pressure for things. I guess I'll first start answering that part. So on the introvert part, people don't necessarily know that externally. I think that I'm introverted. I'm kind of like in the middle, but every time I do my Myers-Briggs, I'm INTJ every time. I try to do it like 6 different times to see if I get a different one, and that would actually grow into a different type. And I'm the same freaking one every time. It's kind of crazy. I'm like, I don't get it, but I'm always the same Myers-Briggs type. So my introvert is also how you get energy fueled. So it's not necessarily, I used to think it meant like you're explosive or talkative. Like you could still be kind of like a talkative person, but introverted, because it's really where you get your energy from. So like with my immediate friends, I can talk all the time. But like externally, like if I do a conference, I like literally need like a week rest after that. When I was the president for the National Association, like I literally disappear during conferences, and I just like do the Irish goodbye where you like just disappear and you don't say anything. I go and take a nap in my hotel. Like no one can tell. I go take a nap. I would act like I'm going to lunch with somebody. I bring my lunch in my hotel room. So I do all these like techniques to get myself a break. Nobody knows that, but it was really hard as the president, because you literally, with the conferences, I'd be on at like 6 a.m. with just people grabbing you the whole time, all the way to like 11 o'clock at night, because you have to do a gala and a dinner. And like, so I struggle with those things where it's like the social things, the big like galas, and because something about it just it's like, I feel like someone's just pulling my energy out. It's like it's like my energy is just draining. But externally, it's like it's showtime. So I think part of me is just like, it's showtime. I'm able to turn it on when it's like work, because I like work. So that's a space I'm comfortable with. But what I do is I actually connect myself, but you said networking and presentation is like, I get myself to do and talk about the things I'm comfortable with, or speak to 1 or 2 people to begin, instead of thinking I got to talk to a lot of people. And then also realizing like, I'm not also that important. Like people aren't really paying attention to you to that level. Like sometimes you feel so shy when you go into a social situation, because you feel like people are watching or noticing you're not talking to people, or you're wallflower. Honestly, everyone's just feeling the same way actually in the room. I think it's like 80% of other people feel exactly the same way you do. That's why people drink alcohol and all the other things to loosen themselves up. So I think when you realize that too, it's like everybody is in the same situation. I just try to find one person I connect with, and then after that it keeps going. But I also build in breaks. So like I said, I literally disappear, or I have to have like a day off when I come back from the conference. That's why it's hard for me now with my because I'm doing coaching, I'm doing practice, like I'm talking all day. So that is hard, because then I go and have to disappear. I'm known for like, I'm a big spa person. So I'm like, that's why COVID's messed it up for me. I use a massage all the time, reflexology. I have 2 saunas, a sauna bed. So I'm like, I love anything with spa stuff. So that's how I get myself grounded too. But so that's one thing. And then I think the other person was imposter syndrome. So imposter syndrome has been, I think, my imposter syndrome was always that I wasn't smart enough, or good enough. And I think that came from, I think when I went to college, like it was really easy for me in high school to get good grades. And then when I went to college, that did not happen. Like I felt like I studied 5 times more and I had bad grades, or I would like tutor people and then I'd get like a C on something, or a B, or whatever it was. And I'd be like, what the hell? Like I'm tutoring them to train them. And then like, cause I had a lot of anxiety. I had the same thing my patients have. That's probably why I connect with it. So I was depressed at Cornell. I hated it. I wanted to drop out of school. I didn't say that part of my story. I just was like, I didn't enjoy the experience. I just felt like I was like, wish I'd went to, a more balanced, I wasn't ready for it. I didn't like understand it until like get into the groove of academics until like my 3rd or 4th year, because for me, stuff always came easy. It just showed up. I'd forget in high school, I'd forget I'd had a test, but then I still get an A and didn't do home. I'm still actually like that. I'm very disorganized. So like I forget meetings. I have an assistant to tell me every day about my meetings, when the meetings are, because I'll forget. I have alarm ringers on my thing, so I stay on target. People ask, how do you do so many things? I have to remind myself of things multiple times. So that's just not my thing. So being in school to that level of regimen was just like, what the heck? And I didn't know how to study. So I always had that for a long time, that like I wasn't smart. So what I was always good at though was work. And so what I learned when I was in school, I started doing the things I was good at, and I became really good at working. I worked at career services. I helped students get jobs. And I was like, wow, I'm really good at this like work thing. And so once I built confidence in that, and that's what I would say is like, I built confidence in the things I was really good at instead of focusing only on the things that I wasn't good at. And that's what kind of got me out of my shell, because I always felt like I was stupid for some reason. And I think probably, I guess, getting raised in a certain way of like, oh, you're this, but you don't have common sense. I always thought for some reason I wasn't like smart enough. And so, but what I always found that I was like good with working. And now I feel like I'm really good clinician. I'm a really, really good doctor. I teach a lot of doctors on clinical things. I don't think I'm the smartest person out there, but I'm okay with that because I do know I'm smart in different ways and in different things. And so I think getting confident in like, okay, in that piece of what you're good at is a helpful way to kind of get over that. And then also looking at like, how would I treat somebody else? Like if I look at myself on paper, what would I think of somebody else that did that? Having grace, because we don't have grace on ourselves. We have grace for other people, but we don't for ourselves and our accomplishments and what we've done. And so I've failed so many times, and I actually it's like for failing, it's like bring it on, because failing is how you learn the most. The most successful people in life fail a lot, but the difference is they fail fast and they learn from their failing faster. So my whole thing, even with my business, was like, how do I make a whole bunch of mistakes, fix like this new thing that I'm doing? It's going to be messed up. There's going to be a lot of mistakes, but I know I'm going to learn from it. So I stopped being scared of failure. And so a lot of imposter syndrome I found is related to perfectionism. And when you're a perfectionist, we see that as a good thing, but it's not, because it means you're usually fearful of like putting yourself out there, or you don't trust what you're going to do, or you're not confident what you do. And so like it's like the 80% rule. If it's 80% good, you push it out. I feel like I'm like 51%. It's like even this presentation put together, I didn't actually know it was at 7:10. I'll tell a secret on the call. And I talked to Stephanie. She's like, yeah, you have to put a whole presentation together. It's like, what? I didn't know that. I was just going to go up and get interviewed and talk. I just put something together and it was done. So other people would stop and say, got to do this or this. We got to cancel. We got to reschedule. It's just like, I'm the 51% rule. So just do it. And like, it all works out. So that's the biggest thing I think with imposters. Sometimes it comes to like trying to be perfect, and the perfection is usually from insecurity more so than really trying to be perfect. So I feel like I talked too much on that, but.
No, we love it. We all struggle with that. So our next question is, how do you react and approach a patient whose treatment is coming out non-progressing or a negative result?
So I typically tell my patients, because I track it long enough, that like for the treatment that I expect at least like X amount of percentage, like depending on the condition, like 20% improvement by the next 4 to 6 weeks. And then every 4 to 6 weeks, the same level of improvement. And I tell them that if they don't change, because we'll retest at like the 3-month mark, but they don't start feeling better by the 2nd or 3rd month, then we have to reassess and change the approach. And so then we change the approach again. And if not, I'm not hitting it, to be honest. Like that's the part of, I guess, the imposter or confidence piece. If I'm not hitting it, like they're feeling better in like the 4-month time frame, I'm going to do a collaboration with other doctors in my office to review the case and find out what's going on, or is there a different angle I'm not looking at? And I might refer out. So I think that's one of the challenges that a lot of doctors don't do, is we keep kind of work like, oh, I don't know, you're just tired, or okay, you're not getting sleep, I don't know, and then change the medication, it doesn't work, and then they're just like, I hear that all the time from patients. And for me, like, I don't stop there. Like, I might not be the person that fixes you, but I sure as hell I'm going to get the best person to get you in front of to get you better. And I'm okay that doesn't mean I'm a bad doctor. And so I think that that's sometimes what happens is like, you know, I'm not going to have somebody suffer and be sick for a long time. If I can't do it, I'm going to connect into where I think that might be more appropriate. That doesn't fortunately happen a lot. But to me, I always tell my patients, I'm like, sometimes when that happens, which I do have happen, I'm like, I care that you're well and healthy, and I don't think you need to be in pain or suffering. And I want you to be well. If it's with me or without me, I'm going to be here for you. I want to check in with you once you get care. So like they really appreciate, like I literally have patients cry because of that, cry when I say that. Which is interesting because I might not be the person that fixes them, but my point is that they feel really heard of just like someone cares enough to really, or if let's say they got 3/4 of the way, which is usually when that happens, but there's 1/4 of the way left. And then it's like, okay, we need to do something else. Somebody else needs to look at it that's objective. And so I think that's how I handle that is I make sure to figure that out fast and try to get them everything they need. And then if that doesn't work, then it's, you know, who else do they need to see outside of me? Until we get to an answer, you know, until we get it fixed.
Do you ever have people doubt what you do because you aren't a traditional allopathic doctor?
I did. Yeah, I did. I actually used to a lot. Like when I first took the path, like, you know, my cousins are like, that's quackery. Actually, the one, he got won over because he called the school. He's a open heart cardiologist, cardiothoracic surgeon. He called the school and found out all the requirements. And he's like, oh, okay, this is actually like legitimate. The other one was so not into it. And he like asks me stuff now all the time. The other one was actually internist, but he's in Portland, which actually Portland, it's very popular. So he heard of it, knew and worked with an ND. So he was cool with it. I did have that a lot. Like when I worked in the Bronx, I remembered working with the pediatricians and they go, oh, you're an ND. They're like, but that's the way I used to get a lot. You're normal. I see like, what's the like, and I'm like, but you seem normal. I'm like, what's normal? Like, you're not like a tree hugger. Like, you're like kind of like cool. And I'm like, okay, or smart. Or that's the other thing. Then they'd be like, oh, but you're smart. You seem like you know what you're talking about. I'm like, but I don't know why you wouldn't be. But I think they thought like you'd like this kind of hippie and was going to come in and like, you know, boho, although I like boho look, but like, you know, all out there kind of thing. And so I think that's the other thing people don't realize. You could be in many different things and look different ways and act different ways, have different personalities. So there's this kind of image for people. So I used to get that a lot. And I feel like it happened more when I was less confident because I was new and coming out. And then like now, if anything, I convert people over just by the sheer value of like everything I'm doing, that now it's like, I literally don't even have that conversation. If anything, people are like, actually several people, like even in the last 2 weeks that have really sick, they're conventional MDs, ones like orthopedic, you know, also like internal have come to ask me to train them on learning more about it. So I actually have the opposite now, to be honest, way more than the other way. But definitely initially was not like that. And I think it's because I probably didn't have as much confidence either.
Another question is, how was the change when you became a medical director?
I'm starting to look at where you said, how did it change?
How was the change when you became a medical director?
So the change, so from going from like a healthcare administrator to running a business as a medical director, it was a big life change. I ended up working way more. There's a joke about that with entrepreneurs that it's like you work 60 hours a week, but the difference is you work your 60 hours per week, which is true. Like I could just be like, I did that actually during COVID. It was so busy in April. I told my staff, I'm really good at predicting. That's part of my INTJ, where the future is going to be. And I was like, we're all going to burn out in July. Let's prepare for that. Like I already predicted, I was like, because everyone's going to be calling us. It's going to be like a hot mess. We're going to burn out and we're going to need a break. And sure enough, July, it literally like clockwork July hit. We were like, I know because everybody that asked me a question, I was annoyed. Like every patient question, I was like, oh, and I was doing that so much that I'm like, I'm not like this. So I got to leave. So I just literally canceled all the schedule, took off for like 8 days. You can't do that when you're in a traditional medical. You can't just be like, hey, I'm not going to work for the next week. That's the cool thing about being a business owner. We did that. I had all my staff. We took off Fridays in July, not planned at all. We decided that 3 days before. and we change it. So the crazy thing is you end up working a lot more, but the difference is it's like you can still like I'm only seeing patients out 3.5 days a week. I'm going to cut down the end of the year to 3 days, and I'm going to hire other doctors because I'm also doing concierge, meaning it's like boutique where people have 24-hour access to me, but they have to pay a lot of money to get that. It's like boutique, so only a few. And so I'm kind of changing that model too. And why? Because with us, I think as naturopathic doctors, we really believe, and I think your generation is like that, the younger generation, on the work-life balance. I think my generation, because I'm 40 and like older or not, we're not trained that way. We're just trained to work really hard to make money. And I think the younger generation is very much more like, how do I also have a living with that? You know, how do I enjoy my life? And so I think naturopathic doctors were naturally thinking that way because that's what we try to get our patients to do. So for me, I really love it. I do actually work way more than I did when I was corporate though, which is kind of funny.
Thank you for that. So our next question will be, do you work with PAs, MDs, and or nurses? If so, can you touch on your connections and relationships with them and how they work together?
Yeah, so I do. That's one of the things I really, really believe in. So we have an MD and internist in our office as consultant we work with. Now I actually have affiliates with this whole like medical group of doctors, of specialists. So I will refer to them oftentimes in telemedicine. One of the things I really believe in, like 80% of our patient base is referral. Mostly either through patients or other doctors, and they're not naturopathic doctors. Almost all of them are not NDs. They're actually oftentimes MDs, sometimes a lot of psychiatrists, mental health providers. So they're all over the board. So I definitely have done that when I was in healthcare administration and creating those models. It was all actually MDs, PAs, and nurses. Nurses are amazing, especially with the educational piece. And so what I did was I built those connections over time where I would like, for example, I meet with a group of rheumatologists like once a month where we go out to dinner because I do a lot of autoimmune conditions. And so now it's awesome because I could be like, oh yeah, I'm going to refer you to Dr. D, and Dr. D will see them right away because I referred. So I'm really good about like keeping my relationships and networking, because for me, that's way more comfortable than me doing a lot of outside marketing. It's really about relationships. So I think that's like one tip of advice I would give to all of you is like really foster relationships, because even if you're an introvert, whatever, you know, extrovert, relationships are not that hard to cultivate. And people, like I said, every job I've had was, or whatever it was created. And you have to stay in touch with people. Like whenever I used to mentor students, I'd tell them, I'm like, the rule is like, I don't want to hear from you like when you need something only. Like I want to hear from you in between. I don't want to hear from you like once a year and it's about getting a job. Like I want to actually have a relationship with you. So people really value that in terms of being able to, for mentorship. And so I always stay in touch with, including my referrals, including like PAs, including MDs and nurses. And so that's how we constantly forge those relationships and meet with them, so that it also helps for our patients. As now I can go, oh, you can see this endocrinologist, Dr. Gonsuela, she's very open to integrative medicine. She's going to trust the protocol. Or this pediatrician, she does this. She's okay if you don't do X, Y, and Z. So I know, so I'm able to collaborate in that way.
Another question is, why did you choose the ND route compared to the DO path? Doesn't a DO use a holistic approach too?
Yeah, so you're right. So DOs do naturally. I think it's changed a little bit. I think before, I know they very much have a holistic approach. I have a lot of friends that are DOs that are actually now doing like more functional medicine. So they do have a holistic approach. They're much more connected with the physical body though, like, the physical being, versus they're not necessarily getting all the training that we do in like supplementation, herbal medicine, all those things that I would be interested in. But their philosophy, I would say, is very, very similar to like how our philosophy is in terms of our approach to treating patients. But they oftentimes go through that traditional track of their residencies and things like that, and in hospitals, which might change that a little bit, just on that path alone versus like the philosophical training you get in school. Also, honestly, I just didn't know about it. So like, probably if I was 18 or 20 now, I probably would have ended up going the allopathic medical route, because now there's functional medicine. Like when I was in school, there was only Andrew Weil, and that was it. And I found out about DO, I think, as I was like applying to naturopathic school. So I think I didn't know, and I wouldn't have known enough, but I do know, like, I definitely love naturopathic medicine, big proponent of it. I'm doing exactly what I'm supposed to do. But now you can actually go to medical school and go to IFM or get certification for functional medicine, all those things that didn't exist before. So I think you have to kind of find out what you want, because some people still might want to go the conventional but aren't really interested in integrative. You could still do that now, which you couldn't really do before. It was kind of like one or the other. So now there's kind of that blend.
Thank you. So our next question would be, what was the hardest class you took during your ND journey?
I hate biochemistry. So that was hands down. I mean, the funny thing was, actually now as I see it now, I actually like it, because I'm always a person that's like, I'm a kinesthetic person, like hands-on, like what's the outcome? I don't need to know every single step to, like, for example, if someone has like a methylation problem, people will go, oh, I have 12 hydroxy, like I have all these different all these pieces, every pathway. And then I'm like, okay, that's great. But there's like 4 things to recommend for that. So like I can know every single thing or master every piece of the lipid, but then there's what, statins and Lipitor to give you, and like 2 other things. So like, is that, for me, there's a little bit of like, okay, how much does that affect outcome and what you're actually going to change? And so biochemistry was always hard for me for that purpose of like every single piece, knowing every step and feeling like, how am I going to actually apply that in practice? And it really is important later for like, for medications and all those things. But for me, it's like I work backwards, versus if I knew like Lipitor and then I could go backwards to the biochemistry, then that's applicable to me. It was always hard for me to learn something, but then without seeing where like it was going towards. So now, like when I do biochemistry, I do it for female hormones and some of the supplements. I'm like, oh yeah, it makes so much sense. And I actually like it because I can apply it to a clinical case and why I'm doing it. So my brain, so sometimes even when I was in school, like physiology, I actually loved pathology, and that was because the pathology went through a disease. So then it's like, oh, now if I worked on the disease and then went backwards to understand the physiology of why that disease happened, that again was applicable to me. So it could stick in my head, but other things that didn't stick into like what I would use it for was always hard for me.
Why do you think this practice isn't used more widely?
That's a good question. I think we don't talk enough to everybody. I think part of it is, and that's one of the reasons why I've been involved in like creating the models in other healthcare agencies. It requires a lot of work of collaboration. So that's the hard part. Like when you look at medicine, unfortunately, we're into a situation where everything is specialty care, right? And we like specialty, it's great. But then what happens is with specialty is like, your heart's not connected to your gut. And this, like you're looking at everybody in these pieces. And then the problem is like, we don't really function that way as human beings, right? We're like full pieces. It's a full flowing thing. And so I think lots of times those connections don't happen, and there's not like care teams that discuss the person as a whole. And I think you could still have all the specialty. I think you have to have it, but then there's not really good systems in place of how they communicate for the care of the patient. And unfortunately, there's models that are being in healthcare coming to help pay people for that performance, like for outcomes, instead of right now it's by number of visits. So if I see 20 people, I get paid 20 visits versus like I see 20 people that get well. That's not necessarily in the current model that's paid in that way. And so it just prevents that from happening because the money stream, it doesn't come down in a way that helps to promote that. Because we all have to, every business has to, hospital, every place has to like meet their expenses. So that's sometimes how doctors can get run down, because they're just, seeing a lot of people because they have to, because that's basically what pays for their salary and the staff salary. And they're not focused on the things that cost a lot of money on the healthcare system, like emergency room visits and, all the other things that could have been prevented. So I think that's why it's just the payment model is not set up to be conducive for
How do you keep up with your own mental and physical health?
Oh, geez. I'm still working on that. So I actually, that's part of it. I talk about my coaching program. It's like thriving in business and life. Because I always tell people, I'm like, you could have a whole bunch of revenue, but then if you're like not enjoying or doing anything, I say one of the things I always say is like, we end up living a lot in our means instead of our end. So like, if you look at the end goal for most people, the end goal is, I want to be able to go on vacation. I want to have a family. I want to enjoy time with my family. I want to be able to take off, like what I said, take off when I want to. They're really general things. I want to be happy. But then what happens is we go to the day-to-day grind. I'm just saying that to all of you as students to remember that you just get so stuck in all these little, okay, I got to get this on this test. I got to meet this. And then you're like forgetting eventually like why you're doing all of that. And so what I always say is like, put a post-it note, say, have affirmations, say like why you're actually doing that so you can stay grounded. And then realizing that like you could still fail a million different ways and still go on the path of success, like regardless. And so that's how I try to stay balanced. Remember, like ultimately what do I want to do? And like, is what I'm doing right now serving me? Is it like serving where I want to go? And so that's what I just said. Like, that's why I'm changing my schedule. I don't even know why I'm like, don't even have it set up that I'm only going to see patients 3 days a week as of starting January. I announced that actually on Instagram, and my clinic director goes, oh, I didn't even say it to her. She's like, she goes, oh, so you're not going to be working on Fridays? I'm like, how do you? She's like, I watched your Instagram, Facebook Live, and you said you're doing 3 days a week. So she started planning around it, and I didn't even talk about it. I was like, some of me put stuff out in the universe so it happens before I know it, I'm going to actually do it. So it forces me into will. So I also do like sometimes, yeah, I just won't do anything 1 day a week where I won't pick up my phone. Technology, sometimes I take the apps off of my phone, like Facebook, all the social media things. I do like meditate. I practice Buddhism. That's my spiritual practice. So I do that like twice a day. When I don't do that, which I've fallen off, I could totally see the change in my life. I read a lot. Miracle Mornings is a great book on like how to start your morning, like affirmations, all those kind of things. And then I actually go to I have multiple coaches for my business. I have a business coach. I have a life business coach. I go to therapy. I believe everybody should be in therapy. That's also how I balance it out, and making time for my friends. So I believe, yeah, I try to get as many supports. Exercise wise, I probably not smart, but I do boot camp every morning. I wake up at 4:30, which is not good because I'm a night owl, but I've been doing that for 3 months. But I can't exercise later in the day because then when I get home after 5, I'm just tired. I'm like, I always think I'm going to do it. It doesn't happen. I'm like halfway doing it. I'm tired. So I do in the morning and I get yelled at in the morning the whole time. So I sit in the back of the class and I try to get through, but we exercise actually outside too. So yeah, I do that to get me in a routine because I need some structure with my exercise or it doesn't happen. I also have like the Peloton, which is good because it's like community building. I'm always one of the people though that like anti-rules. So like everyone says go left and I'm like, why are we going left? I want to go right. That's why I was never in any sorority, fraternity. That's just how I've just been. That's my personality. So Peloton, I resisted for 2 years. My whole family had it. And then I got it and I'm like, what the heck? I was missing out on it because it's like a whole community. So I do that too, because you could jump on with your friends and exercise at the same time. So that's how I do it too. Like I create accountability partners, which you all should do. Like for studying, I'll have like 3 friends and I'll literally just text them random stuff, like business people. I'll be like, I need to send out this. I need to change my website and this by the end of the week. I'm going to update you on Sunday. And then I update them on Sunday. I'm the kind of person that needs to say it. And then that forces me to happen. So like exercise, the same thing. I have now another doctor. She's actually an ER doctor. And every day we say what we did for exercise and fitness. So that's how I keep myself up. And then if I'm struggling, I have somebody, one of my friends who's a psychiatrist, and I'll be like, I'm struggling with this. And she writes, so that's how I do it. I keep in touch with my friends in whatever the way it is.
Wow, that sounds pretty cool, actually. So our next question would be, do you think pharmacy industries look down upon these types of treatments, like naturalistic treatments?
I think some do, for sure. I think it's because, unfortunately, we don't have a lot of people ask for a lot of research, and there's not tons of research, only because we don't have like if a big pharma, we don't have a lot of funding to do those big research projects. Like if you look at pharmaceutical companies, they have money to just study, like you see what they're doing with vaccines and stuff like COVID, millions of dollars to put into research for things. We don't have millions of dollars to put into like vitamin C studying, millions of dollars to confirm those things. So a lot of ours are like clinical cases. I know vitamin D just came out with a study because of everything that's going on. So that is the pieces. I think a lot of people aren't anti it, but I think we need, if we, they're looking for a lot more research. So with everything I do and recommend, there's always like credible research and findings behind it in terms of science. I haven't had that experience. I would say like 10 years ago, I definitely would have seen that. I actually see a lot of pharmacies now have like a wellness component to it. So I've seen a lot of like openness to that actually, but I do think there's a lot more. I think it's always been popular integrative medicine, but I don't know necessarily if it was accepted. I feel like it's been more accepted now. It's been popular by way of consumers, but I don't know necessarily accepted by way of like conventional medicine. But I feel like now, since a lot of conventional MDs or allopathic MDs are starting to dabble into it, it's now becoming more accepted. Like I'd say in the last like 5 years than it was before. So I don't feel like anything like when my experience with that was like 20 years ago, which was a completely different world at that time as it pertained to alternative medicine.
Thank you. How do you incorporate your knowledge from your MBA degree in your practice?
Oh yeah, I forgot to mention I have my MBA too. So I also did that while I was a healthcare administrator. It actually helps me a lot. That's why I was able to be successful so fast in those 6 weeks. Is the one thing I'm really good at, even though I don't like details, I'm really good at systems and structure. So lots of times I know how I want stuff to look and be, but like once it starts going, I'm not interested in it. Like fixing a problem, getting it put together. Although that's one of the things my coach is working with me with. She said, if you always fix a problem, you're always going to have a problem, which I never thought about it that way. She's like, if you always want to solve problems, you're always going to be a problem solver. I mean, you're always going to create problems. So trying to create less problems and solutions to fix. And basically I was really good at systems. Like, okay, this is how I want the new patient flow to be. I want automation. Like, this is why when COVID happened, a lot of my friends, like they had like paper charts and no system set up. When we started our practice, everything was automated. My phones have always been where you can get our phones on your cell phone. I have an app for that. I have an app for our practice. Everything was automated. Everything goes through the EMR system for forms. So like when COVID, it was just like, we practiced it a couple of times. When COVID happened and we had to work remotely, it was no change. There was nothing. It was so easy for us. We all had another computer where we had Google Hangouts. So I could see them on the computer while I'm here with the patient, and I could look over and talk to my staff. So we had everything like systematized. So I think that's how it was different. I was like, always think like ahead, and we were already set up that way. Even with this whole thing with COVID, like as the numbers are going up, we've ordered a whole bunch of supplements because before all of it hit, I was like, we got to get a whole bunch of PPE, better buy these supplements, all the things people are going to ask us. Sure enough, you couldn't get anything, and we had stores. Or like the supplements, like the important ones that people knew for your immune system, like vitamin D and zinc, were on back order for 3 months. So now people are all like, oh, okay, everything's great, thinking everything's going to start going back to normal. And I'm like, no, it's not, because flu is coming in the winter and I want an emergency stockpile. So what did I do? I spent thousands of dollars and we have like an emergency stockpile of supplements waiting. And sure enough, it's starting to come up. And so that's how I've been the best, I think, is like preparing business wise, like way ahead of time instead of only in the medicine part.
So our very last question is, what are the main differences you've noticed between how MD and OD treat patients versus an ND?
I think the biggest thing is our philosophy. So our training is to get to the underlying cause of disease and the root cause. They call it the root cause medicine. So we're going to find, like, so if you're tired, we're going to say like, why did that happen? Where did it happen? Versus saying, I think with conventional MD or DO, or they're usually more on symptoms. It's symptom-based care. So if you have acid reflux, you're going to get Prilosec. If you have your thyroid's off, we're going to give you Synthroid, which is all fine because you oftentimes need that. But we're going to say like, well, why did that happen? When did that happen? is there food or diet lifestyle changes, that occurred before it? We're going to try to go backwards and really find out, or if you have gastrointestinal, if you have, acid reflux, maybe because you should stop eating like these types of foods, or if you have IBS, let's find out what food things you're sensitive to, or you're constantly bloated, that's not normal. And they'll get checked and they have a, let's say endoscopy and a colonoscopy and everything's normal, but they still have the symptom. We're going to try to find out what is it that's aggravating you. So I think it's more like we're detectives in that way of trying to find out, even if they feel better, like why it happened in the first place, so they could just like stop it there. You don't have to keep getting on a longer list of medications, which is always my goal. Even for supplements, I try not to keep getting people's list really, really long. With medications, it's the same. So I'll even do it the reverse, where patients are on like 20 things. It's like, how do we get you on less things? So that's always my goal, is like, what could be the simplest, what's the simplest measure? And I don't think we kind of don't always learn. I think that's also one of our philosophies, like what's the minimum force necessary to have an effect? And I think sometimes in the conventional, it's just everything is by the symptom. And before you know it, sometimes you could be on a lot of things. So I think the philosophy of the why, underlying cause of disease, is like what would differentiate us the most.
Do you have any last minute advice for pre-health students?
Yeah, just follow, let's say from my experience, I always say, if I could talk to myself when I was younger, that like, it's not that bad. Like, it's not, you're gonna be fine. I know I didn't think, I remember in college calling my mom and saying like, I'm gonna drop out. Cornell was like, I'm gonna drop out, I'm done. And she was just like, okay, you always figure it out. There's no sympathy. And then she talked about what my sister was gonna wear for her prom. And I was just like, what the heck? Like, I need, I just remember being like, what am I going to do, that phase of what am I going to do with my life? And it's true, I did figure it out. It's not easy to hear that at that age. Because you want a hug and you want like all the other, that's not my mom, like culturally, that's just not how we do things. And so, but it always works out for the best. And it's hard to understand that when you're doing that. And like, sometimes it's actually good if you fail in one thing, because it ends up putting you in a different direction in the way you're supposed to. Or if you don't have the best grade in something, or you don't have this, you could still make it happen too. I think we put these limitations from ourselves and what we hear from other people, and there really aren't. I feel like that's the thing I'm always pushing, the limits of like, there's no limitation. And that's what people say the most about me, like, wow, you could literally do everything. And it's like, because I'm not, it's like, I'm never gonna not ask, I'm always gonna ask. So regardless of maybe how much experience I have. So it does work out. You just have to just continue to work on yourself. And reach out for help. I think I didn't reach out for help at all when I was young, and I wish I did that more. Like, now I know to, and with my friends and circles, but I didn't. I just would be very quiet about it and kind of deal with sadness or anxiety and stuff on my own. So I reached out for help.
Thank you so much. So that wraps up our shadowing session today. I want to thank our guest speaker, Dr. Jaquel Patterson, for spending this time here with us. And I also want to thank all of my students for joining us. Please don't forget to comment on our website how you thought about Dr. Patterson's talk today, and your feedback is greatly appreciated. We'd love to know what you learned, any interesting facts and stuff like that. So yeah, don't forget to do that. There's a QR code. I'll leave it up for a few more seconds. And then my next announcement is we do have applications open to join our student team. This is a student-based, student-run organization where we really focus on building our professionalism and leadership opportunities for students everywhere. So if you guys are interested, you can also find this on our website under the contact. You can join the team and submit an application. If you don't feel like you have enough time to commit to a new leadership position, that's totally okay. There's still volunteer opportunities open, and it's all online on your own time. Some things that we do is professional nominations and student outreach. And so if you guys are interested in helping out in those ways, feel free to apply to become a volunteer. This is also found on our website at the link at the bottom. And my last announcement, follow us on Instagram. If you guys go to Dr. Patterson's post of the announcement of this talk today and comment letter by letter her last name, you guys will be eligible to be the student of the session. So go ahead and like and comment on our post. We really appreciate it and hope to find more professionals for you guys to shadow in the future. And our spotlight student of the day is Justice. And so Justice was able to complete Dr. Asia Sullivan's last name in our comments. So good job, Justice, and we hope to see you at our future sessions. And I just want to thank again everybody for coming today. If you guys want to get your certificate for verifying your shadowing hours, don't forget to take the quiz that can be found on our website. And I'll go over the instructions right now. The next shadowing session is October 28th at 5:30 p.m. Pacific Standard Time. We have a researcher PhD, Dr. Kamal Dulai, who will be joining us and talking to us about cancer biology. So here are the steps to get your certificate. You are going to go to Dr. Patterson's page on our website and click free take this course. The next step is to click the first module. Since you guys are already in the Zoom session, you guys will already be here. And then the second module will include the quiz. Once you take the quiz, it is 10 seconds. Please make sure that when you go from your next question, you click next and not complete. If you do click complete, it will submit your assessment and you will not be able to go back. So please be really cautious about this. When you have finished and submitted and passed your assessment with a score of 70% or higher, you guys will be eligible to click finish this course, and that will allow you to get your certificate, which can be downloadable immediately or will be stored in your profile. If you guys have any questions or come across any issues, feel free to reach out to us at our email info@prehealthshadowing.com. And that concludes our 8th session. I want to thank you guys all one more time and have a beautiful night. Bye. Alrighty, guys, I think that is everybody. So great job, everybody. That was really great. Thank you again, Dr. Patterson. That was an amazing presentation.
Thank you.
I feel like I learned a lot. I feel like that was just so insightful. So just thank you so much for coming again. We hope to stay in contact with you in the future.
Of course.
Yeah, this is just amazing. Team, do you guys have anything you want to say?
Oh, I can send you the metrics of everything on Monday if you would like it. The Instagram. Oh, you can't hear me?
Yeah.
Oh, yeah.
Better now?
Yeah, that's
Yes.
so much better.
Okay, I can send you the metrics of the Zoom session, the Instagram post, everything, the website, how many people registered if you would like that, those numbers.
Oh, yeah, that'd be great.
Okay.
Awesome.
Okay,
And then for my
Okay, thank you all for doing this too, for
Thank you.
creating this great thing.
Thank you.
Thank
Have
you.
a great night.
You too. Bye.
Bye.
Thank you.
Oh my God, I'm so awkward. Okay, anyways, so guys, great job. Just a little wrap up before we get going. Does anybody have anything to say? No? Okay, basically I just want to be like, we have a meeting on Saturday at 3 p.m. Please be there on time. I'll send the Zoom link a little bit before. And Yeah, if you guys are in focus groups, please make sure that you look at the tasks that you have going on and that you guys have something to present. So if you're in marketing, that's 5 TikTok videos with the whole group. It doesn't necessarily need to be everybody makes a video or one person makes 5. You guys split it up how you want, but you must communicate and have 5 by Saturday. So it's getting short. So if you guys haven't started, I would get on that ASAP. And then for grants, I would like to have at least one grant out there that is like a prospective grant that we could apply for. And yeah, so I will go more into details at this week's meeting. But yeah, you guys did a great job. Thank you so much and have a chill night.
Adios.
Bye.
Mm.
Bye, Kiki.
Nina.
Yeah.
Oh, shit.
What?
Are you there?
Yeah, do you hear me?
Oh, okay. Yeah. So is it Saturday or Sunday?
It's Saturday.
Okay. I was about to say 3 p.m. on a Sunday. I have work.
Did I say Sunday?
I don't know. I heard Sunday, but
Okay, fuck. Okay, I hope I didn't say Sunday. I think I'm still recording.